So we are going to introduce our next panel and the situation that the second panel went on, but as the purpose of this meeting is for you to really start attaching the issues and the sensitivities and the challenges that leaders go through with the model. So a lot of this is going to come back on you. So I hope you're ready. That was your warm-up. So as we go through and we still get to that slide, the blank slide, and whoever has the clicker, don't click past the blank slide. And so when we get to the blank slide, then I'm going to turn it over to you all, and we're going to have a conversation about all of the different behaviors that they are demonstrating. So we'll go ahead and turn it over to Megan.
Okay, well, good morning. I'm glad to see that there's so many people here today. Unfortunately, I wasn't able to come to the last session, but this is great. So my name is Megan Moore, and I'm the Assistant Director with the Department of Agriculture Weights and Measures. So I'm really excited this morning that we're able to come and speak to you about a really neat topic, marijuana. Very different from the first panel, so you'll be learning some very cool things from us. It's very exciting that we're able to come here and share some of our experiences with you in relationship to the leadership development model. So before we get started, what I'd like to do is just ask each of the panelists to introduce themselves. Start.
I'm Thomas Ledford with the Office of Strategy and Intergovernmental Affairs.
I'm Alex Bell. I'm with the Luge Executive Office.
Gloria Estolano with the Department of Environmental Health. That's all right.
You know how to turn it on, so we'll just do this.
Gloria Estolano with the Department of Environmental Health.
Joe Fracci with Planning and Development Services.
And I'm Justin Crumley from the Office of County Counsel.
Thank you. Okay, great. So why don't we go ahead and get started. So as a manager, as a leader in any department in the County of San Diego, it's always our responsibility to be scanning the horizon for things coming that could possibly impact our county, our departments, our communities, and our stakeholders. So one way we do that is that we monitor legislation. And in 2015, there was new legislation introduced that has to do with medical marijuana. And potentially this new legislation could really impact how counties in the state of California regulate medical marijuana. So we recognize that, and in fact, many departments across the county recognize that, the magnitude of what this legislation could actually do. And most of us anticipated that the legislation would be passed. So, at the direction of Sarah, AWM took the lead on the formation of the County Medical Marijuana Working Group. So Sarah affords us a lot of autonomy, and she's really great about asking just the right questions to get us thinking just the right way. And taking her direction, we go and we develop where we need to be as a working group. So what is a working group? It's pretty simple. It's just a group of people, subject matter experts, that come together for a shared purpose. We take our knowledge and information and we share that with others, and we make recommendations based on our findings. I guess I'm supposed to be running this thing. Oops. Oh. Thank you. Oops. Okay, so who's involved? As you can see, it's many departments across the county. When we started this, we reached out to any department that we thought could possibly be impacted by the medical marijuana legislation. So the working group is multifaceted. We do a lot of different things, but basically we're focused on working together to get ahead of any changes in laws and regulations. It's our responsibility to recognize and identify impacts, both positive and negative, that could possibly happen to the county and our departments, and also to identify any risks and the mitigations that go along with those. So we do that. But we do it through study and the 3 C's. And I heard it mentioned in the previous panel, coordination, collaboration, communication. This is what the group does all the time. So as individuals, we work to go to different working sessions, workshops. We work with our other counties and jurisdictions. We also reach out and work with the state of California on trying to learn as much as we possibly can about marijuana. And of course, we read an awful lot. As you probably are aware, there's lots of accounts and articles that are in the news all the time. So we try to keep up on those things in addition to what's happening at the state level and at the local level. So what do we do with all that knowledge that we gain? Well, we come back to the working group and we share it. We collaborate, we share, we work as a team, and we help each other. So we've learned an amazing amount about marijuana, but what I would say is we've learned even more about each other and each other's departments, how we work, what we do, and how it all works together for the County of San Diego and for the community. We are the think tank for San Diego County when it comes to marijuana. And we are ready to address and are always preparing to address whatever could possibly come our way. And that changes all the time. And in fact, we have a lot of challenges that we've been faced with. And one of the first challenges that we had to face was, who's going to even be in the working group? We had to get the right people to the table to make sure that we were utilizing all of our knowledge to the best for the County of San Diego and the community. Because there are a ton of unknowns about marijuana. And I mentioned medical marijuana, but as you'll hear later, it's more than just medical now. So we have to take that into consideration also. And most of the departments involved in this have never had anything to do with marijuana. So this is a completely new landscape that we're just learning about. And it takes all of us to learn about it. What I would say is the biggest thing that I take away from my experience thus far in the working group is just how flexible and cooperative and incredible we can do things as a team, as working together. It's been really exciting, and it's going to continue to be exciting, I'm sure, into the near future regarding new elements of medical and adult use marijuana.
Megan, when you said that you didn't know anything about marijuana, so when you were, it's a serious question.
Sorry.
Did you inhale? No, just kidding. So here's my question. When you were faced with this and it's something that's completely blank, how did you feel? I mean, when you are posed with a challenge and you're not familiar with the subject matter, how did that make you feel when you initially got that, and how did the team take that and work with that?
I would say the word that comes to mind is excited. I mean, that's what we do here at the County of San Diego. We're always looking at new things. I mean, that's part of the excitement of what each and every one of us do here, right? We're faced by challenges, we dig into them, and we figure out the best way to go. Mm-hmm. And so I would say excited is the word that comes to mind.
In the audience, how many of you, when you get up against something that you don't know, do you consider that exciting? Let me see your hands. Yeah, and how many of you just think of it as a little bit of a scary challenge? Yeah, it's true. So let's go to the next slide, but not the next.
Oh, thank you.
There, stop there. All right. I have to control this. So, go ahead. This is what I want you to do. She just laid out a whole big part of this for you, and she's got deep into it because she has the team. They have the working team now. They have an issue that they don't know. They anticipated this. It came out a year before, so they were already talking and thinking about what we're going to do with this in case and anticipating that it happens. So let's see. Let's just yell out what behaviors and competencies you see already being demonstrated. Initiative. What part of initiative?
Anticipate prepared for opportunities and not obvious to others.
Yes, exactly. What else?
Looks beyond department boundaries to making decisions.
Yes, exactly. What else?
Well organized.
Well organized?
Seeks opportunities for continuous learning and development.
Perfect. Any others? Let's see how you did. What's that?
Network.
Networks. Perfect. What was that one?
Place beyond department boundaries.
Yeah, so they're already looking all over. They got this and they said, no, we need to already have this working team in place. So we're going to spread our wings. We're going to work with other people so that we could get their knowledge involved with this. We don't know about this subject, so we need to start collaborating. In fact, she said those the three words. What were they? Exactly, right there. That hits 3 different competencies. Well, let's see how many they hit. Next slide, please. This is going well. This is everything. I mean, and probably more. I was going through and I was trying to pick out the more obvious ones, but all of these things they've already hit. The 2 main ones were initiative and organizational acumen. It's a political issue. It's huge. They're coming up. They have to take it on, and it's also they're taking initiative of how they're going to do it. And so these are all the different areas that they hit. So let's hear more of the story.
Okay, I'd like to pass it on to Thomas now, and he's going to give us an overview of marijuana policy in California.
Good morning. So I'm not going to go too deep into the rabbit hole on the history of marijuana, but it started back in 1996 in the state of California when we passed the Compassionate Use Act. That remained pretty much steady until 2003, when this was supplemented by the cleverly numbered State Senate Bill 420. These two together kind of formed the loose framework which led to a nonprofit dispensary system that persisted for over a decade in the state. It didn't really lay out any kind of real regulatory framework, though, and the state agencies didn't really enforce or become that involved. In 2015, this changed. The state legislature saw on the horizon the eventual passage, kind of the writing on the wall of recreational marijuana. That would be in November 2016. So in 2015, they brought a 3-bill package forward, which essentially laid out a framework. This is the Medical Cannabis Regulation Safety Act. No one really wants to hear the acronym for that.
Go ahead and say it.
MCRSA. In the long run, this kind of both helped and complicated the situation because this laid out a framework which Proposition 64 later in November of 2016 for recreational marijuana somewhat followed. It mirrors it in a lot of ways, but it doesn't follow it exactly. So come the next year, November 2016, we have the passage now of recreational marijuana. So we have a framework for medical, framework for recreational, and that kind of left our group where we are. So I will pass it on to Joe and Justin for the...
Wait, next slide, please. Okay, so what did he talk about? What areas did he cover? There's 2 primary areas, I'll give you that. I know you're processing, I'll wait. What are the 2 main competencies that he just hit again? Organizational acumen and initiative. An initiative because they knew about these. It's been coming for a while, and so they knew about it, and they didn't just sit there waiting to say, okay, well, I'll wait till something happens before I do something with it. They took initiative a long time before and made plans for anticipating. They didn't know what was going to happen with it, but they thought, okay, what are the options here, and how can we plan with that? So both of those were the 2 primary competencies. We could flip the slide. You'll be like that. I can flip. Okay. All right, we'll go to the next one.
Okay, so good morning, everybody. So the thing I wanted to talk about a little bit is how we tracked and monitored and reported out on what was happening with the marijuana issue. And as everybody in this room can imagine, extremely complex, dynamic, ever-evolving issue. By way of background, in addition to the Compassionate Use Act, the prior laws, and the new legislation, and then the Adult Use Initiative that took place in November of last year, the county itself has medical marijuana regulations that we adopted back in 2010. So as part of that and all of that dynamic taking place, there was always a lot of interest that has been spurred on, first of all, by the public, and the public wanting to know how they can utilize our existing regulations, what the state was doing in terms of medical marijuana, what the state was doing in terms of adult use. there's always that confusion between the county and the city, what does the county allow and what does the city allow? So we had to be real knowledgeable of, not only what was happening here, but what was happening in other parts of the county and in other parts of the state. We have 26 community planning groups. Some of them are affected by our existing regulations on where medical marijuana facilities could go. So obviously they have an interest of what is taking place and these new laws and the existing ordinance and how it affects them and how it affects their communities. And then because of everything that was taking place, we also had many media inquiries. So we had to coordinate internally within the group, with Luge, to make sure that we had a consistent message moving forward in terms of the county's position and how these the legislation initiatives affect us and how they affect our current ordinance. We also took we were also real cognizant moving forward about briefing internally. So the group itself, we would meet and, brief ourselves and make sure that we were up to speed. But, we also briefed our departments, the Luge, and we also took the opportunity to brief the county executive team at an event. And we also had the opportunity to brief the board offices. So again, they had a lot of interest because there's a lot of interest from the public. They were obviously getting pinged and heard a lot through, their constituents asking them about our existing ordinance, what the legislation means to us, what the upcoming initiative was going to happen. So that being the case, it was real important, the group itself, our group itself, our working group, that we were all on the same page in terms of our messaging and moving forward and being able to tell the same story consistently from whoever, whether we received an inquiry from the public, from the community, from the board offices, or from, our management team.
So when you were doing this, how many balls did you feel like you were juggling at the same time?
Many.
Yeah.
Yeah.
And so just to get a crossover here, how many of you have done a project or something that you were on that you just felt like there are many balls that you're juggling at the same time that you can't really drop any of them, you have to keep your eye on them? And then to add to that, they're responsible for answering questions. And you're saying that they're asking you and they almost have an expectation that you're going to have an answer for things that haven't actually been done yet. And so your mission was to be on the same page so that everybody is either saying an I don't know or whatever the answer might be. How many of you can relate with that? It's an issue. I mean, it's a challenge, and this is part of some of the things. It's complex because our problems as leaders aren't simple. They become complex. So looking at this, just share some of the competencies that were displayed in that, or using your own scenario, what are some of the competencies and behaviors that are displayed in there?
Organizational acumen.
Organizational acumen. What if one of those balls dropped? What if somebody gave a different answer than someone else and they have the same information? Give me one more. Interpersonal relationships? Who said that? How? And share that with me. How?
In the constant communication, understanding each other's perspectives or how this potentially emerging issue could touch on the various departments, from a zoning perspective, from an edible food perspective, from cultivation and agriculture measures, with additional legislation that might be coming out, big cash crops, business laws, share it.
It's huge. And it crosses over with individuals' communication styles too, because a lot of us like to work independently. A lot of us like to just be individuals. We don't necessarily like to share. We're not into interpersonal relationships because we don't need them. We just like to be by ourselves. And in this situation, that's not possible. It's not possible at all. You have to communicate. You have to share your information so that you are on the same page, because the implications of not are huge. And so I want to share that with you so that as you start hearing their story, you relate it to your own situations and things that you're doing in your departments. Thank you.
Okay, so So we gave you some background on everything what was going on in terms of the state legislation initiatives. Then to make things a little bit more challenging, early in 2016, as a result of some community interaction at the board hearing. So what was also happening at this time is because of everything that was happening with marijuana, there was more movement in terms of marijuana facilities going in the county. And this issue did come up at the board, and as a result of that, we received some direction from the board to come back with some various options to further regulate medical marijuana in the county. So again, that was just another layer of complexity, another thing to essentially juggle and understand. So as a result of that, one of the big things that we needed to do was fully understand the issues and fully understand a strategy and develop a strategy and approach moving forward as we started bringing forward reports and board letters to the board. And one of the first things that we got from the board, so we went to the board a number of times. We went in March and April, and then most recently this past January. But one of the things that we needed to do besides the ordinance options is we got some direction from the board, or what the board did do is adopt a moratorium to prevent further medical marijuana facilities to come forward until we develop these options. And then we ran into some issues with the moratorium on some folks that were in the pipeline. So just to talk a little bit about those legal aspects and the challenges facing that, I'm going to hand it over to Justin to talk a little bit about that.
Yeah, it was definitely challenging. As the lawyer of the group, my initial interaction with the group and with management at the county level was to take some what are pretty complex laws and to translate those into bullet points that are easily digestible. I'd be willing to say, if we asked for a raise of hands, who actually read Prop 64 in its entirety or McChristen in its entirety in this room, and it's probably going to be very limited. But that was my initial kind of to interpret and digest this, and then to answer questions from the group. On a daily basis, I pretty much to this day, over the last year or so, receive questions on interpreting the laws. Does the tax apply here? Can we apply our own tax? What does the city's tax apply to? Can we split cultivation and storefronts? How do we do that? So when we went to the board, as Joe was saying, we received direction from the board, and to complicate things even more, we received split direction from the board. So they directed us, on top of our current ordinance, to come back with 7 different options. And then we went to the Planning Commission because it's a zoning ordinance amendment, and they added an additional option. So when we went to the board, Joe and I had to craft 8 different ordinance options as a variety pack. And then when we went in January, the board composition changed, and because of that, they decided not to go with any of the 8 ordinances that we developed. And they directed us to come back, which we are coming back in March, with an ordinance that will ban all medical and non-medical marijuana facilities in the unincorporated county. So one of the things that we had to be flexible with was the direction of the board and the changing composition of the Board of Supervisors. So those are some of the challenges. What's that? Yeah, so our zoning ordinances in the County of San Diego generally apply to the unincorporated area of the county, and the City of San Diego has their own marijuana ordinances that would apply to where they can site facilities. So when we develop options based on board direction, it generally applies to our zoning authority over the unincorporated area of the county. So where medical marijuana facilities can be located and operate within the county, within different types of zones, and in our county, it's industrial zones.
So, Justin, how much work went into putting those 8 proposals together?
It was a large amount of work that we went through to make sure. One of the challenges that we had was with this variety pack was not each of the options stood within on their own. So we needed to be able to craft it, and I've never crafted an ordinance in 10 years as a lawyer working for public agencies like this, but to where it was a variety pack where they could choose option 1 and option 3, option 1, 3, and 5, option 2 and 7, or just stick with the current ordinance as we have it. So in that respect, it was extremely challenging, and we kind of had to think outside of the box to really come up with how could we accommodate not knowing what they were going to choose in the end.
Mhm. And did you say that you had a questionnaire, a question and answer document?
Yeah, we, the whole group here worked together. We had, what we like to do generally when we go for the board, especially with controversial items, is to come up with a question and answer period so that when you're up there and they ask you questions, you know the answer. And you rehearse these things over and over again. And for complicated items like this, we had, I think, around a 30-page question and answer developed that range from everything across the board, from initiatives to taxes to the current laws to when they would go into effect, when people could get licenses, and then also how our current ordinances work, what you're allowed to do under those current ordinances. And that way, when you're at the Board of Supervisors and they say, well, when do the taxes kick in for the recreational licenses and when will those be answered? We know exactly who on that panel at the Board of Supervisors on the dais is going to answer that question, and we know exactly how they're going to answer it.
So how many of you worked on a project with a team that you just put everything into it, everything, and you knew you were ready, you had the answer? How many of you have had that incident? And then for them, and they go to the board, and the board says, thank you, I see the 8, I don't want any of them. Right? And so what, as a leader, as a group, as a working group, what impact could that have on the group if they weren't displaying some of these competencies? And so I love this story too, because it tells a lot about the resilience and what they did in this. And so if we go to the next slide, I want you to talk about there are huge chunks to this story, and it's a little chunked out, but I want you to relate it again to some of the projects that you've worked in and the walls that you've hit and the setbacks you've had, and share not only what behaviors and competencies, but attach it to why. What did you hear here to attach that behavior? Yes.
I like the resiliency and recovering quickly from setbacks. I mean, I work with Joe all the time, so I know that we got out of the board hearing and went to work to recover quickly and kept all of our spirits up while he was busy on the house.
Wow, and kept your spirits up. Excellent. That's even better. Good job. Yeah, good job. What else did you hear? What other competencies and behaviors?
Remains optimistic and persistent even under adversity.
Yes, did you say that because he said that he kept them up? Optimistic? Yes, and you have to. I mean, it's funny because I've seen people go through this and they hit a wall and they crash. And what happens with them is like their whole morale goes down and their mood goes down. And all that does in the end is stop them from doing their best, and it stops them from moving forward. And so they go through this. And so this is a really good lesson of just getting back up. I mean, he might have had a couple grumblings. I don't know. He has never shared that with anybody. But he still gets back up and he keeps going and moving forward, because as we've been talking about before, there is no other option. That's what we have to keep doing. They can't be like, oh, well, wow, that was tough. I give up. I'm not going to try anymore. It's not an option. So they have to keep moving forward. Let's show the next slide. I want to just demonstrate this. How many? These are all of the different behaviors that they've displayed in this. And you could see it hits problem solving, huge, getting into all the different areas of what they're doing with working together, staying on board with it, and also results orientation. They're following through with their commitments. They're persisting. They're not letting this drop. And this is what this model is all about in the complexity of a situation like this, where you start putting these pieces together. Again, I want to emphasize they didn't look at this and say, what do we want to demonstrate? They're doing their job, and in their job, they're demonstrating all of these different behaviors. Thank you for that. All right, who's next?
Good morning, everybody. Megan mentioned how diverse our group is. So what I want to do now is to share some of the different perspectives that we were discussing as we went to got into this issue in our group.
But I'm just a little higher. There you go.
This diversity is actually something that has been essential for a work group. Being able to look at all the different perspectives, also not only being able to anticipate how this is going to impact our individual programs, but also what risk cumulatively we can anticipate that this presents to the county. For instance, I'll talk about, in DEH. DEH, we are very interested in marijuana edibles. We, from the beginning, when this whole process started with new law went into effect, we knew that we might need to be regulating this, but we didn't know at the time. So we wanted to find out, and we proactively reached out to the state. We wanted to find out whether were they going to be regulating these as food, or we thought they were pharmaceuticals. And they said, well, actually, they're not pharmaceuticals, they're not edibles, and we're going to be just crafting regulations specifically for medical marijuana or for marijuana edibles, now both types of edibles. And the state, the California Department of Public Health, they're charged with having regulations ready so they can be implemented on January 1st of 2018, and that's just 10 months from now. So we wanted to be part of this process. So we have been reaching out to CDPH, the California Department of Public Health, because we want to be part of that process, because we're going to be regulating them. We know that we are going to be regulating edibles locally, so we want to have a say as to what we're going to be implementing. And something else in DEH is that we also are interested in those manufacturing facilities that are going to be making concentrates. We know they're going to be using hazardous materials. We know they're going to be generating hazardous waste. So our HAZMAT program is also going to be impacted by these new edibles that are going to be produced soon. And they're already being produced, actually. A perspective from our Agricultural Weights and Measures Department is that many of the programs are really impacted. I mean, look at cultivation, certified organics, their nursery, retail nursery program, and of course, Weights and Measures. They, as we do, have a similar process where we have inspectors in the field, we conduct inspections, we work with compliance, when necessary we do enforcement. So we were looking at all these facets, but we were also looking at other things. I'm sorry. For us, something that it was very new, is very important, is to keep our inspectors safe in the field. This is an entirely new process we haven't done before. There is hesitancy probably from some inspectors and going to these facilities. So that's something that we're also going to have to look at into what kind of training do we need? How do we need to make sure, what do we need to do in order to make sure that our inspectors are safe when they're doing these inspections? Something else is that this is an added workload. So how are we going to manage all the complaints that we might receive? And also, how are we going to pay for all of this? Are we going to need new stuff? And how are we going to be getting cost recovery for this? You have just listened to Joe and also to Justin about just the detailed work and going back and forth, all the work that they did to coordinate, all the options that they put together to the board for changes to the ordinance. And something that they did, well, they were doing all of that. They were participating in the work group. And also they were making sure that whatever changes they were proposing, they really were in concert with the different departments and making sure that something that they wrote on the ordinance was not going to have, unanticipated consequences for another department. And you heard from Thomas, and with the Office of Strategy and Intergovernmental Affairs, what they do is they're scanning legislation all the time, what's going on, what's coming in the future, and he was able to provide that perspective to the group, and also be able to tell us about, the workshops that were coming up, information that he was finding, so we could also get that input into what we were looking at. We also have the public safety group, and for them, they're really concerned about public safety, and they're also are going to be charged with enforcement. So there's a number of things they're interested in. One of them is, probably increased use of marijuana by minors, especially now that the adult use has been approved. And so they need to be able to figure out how we're going to prevent this. They also have to look at the issue of driving under the influence. There are established limits for alcohol right now, but those don't exist for marijuana yet. So that's something else they'll need to tackle. And something else that they probably don't do now is, in households now under the adult model, they can have up to 6 plants, cultivate up to 6 plants in their own household. So how are they going to be monitoring this, and how are we going to prevent that some of these households, start with 6 and then end up with 36 or 60? So this is also going to create a big impact for that group. And lastly, I want to give you the perspective from the Health and Human Services Agency. The agency has dual role in this. They are the agency that issues the medical marijuana cards. These cards have 2 functions. For people that are stopped in the street, they can demonstrate that they have a medical reason why they're in possession of the substance. And they also they have an exemption from paying taxes when they buy these products. So this is probably going to continue, at least for the portion where people want to, not pay taxes when they buy a medical product. But on the other hand, with the passage of Prop 64 and the adult use, they see that there's probably going to be an increased demand for the services. They'll need to really increase their efforts in public education, trying to stop diversion of marijuana to minors, and also perhaps really also increase demands for behavioral services, for social services, and programs for prevention, treatment of addiction, etc. So those are just some of the perspectives, or many others that we saw. For us, when we're looking at edibles, we really, truly had no idea how many different products really can be infused with marijuana. It's just staggering. What do you find when you go on the web? These are just some of the examples. So getting a line from Rebecca to end on a high note, I want to let you know that the strength of our group has really been the diversity of the group and all the different points of view that we have brought to the group so that we can analyze it, really have a comprehensive analysis of what the risks and what the issues are for us. And we all have learned a lot from being in this group. We learned about what each one of us does. Even though some of us had already worked together in other projects, this has really increased our collaboration. And also, this is just not in the work group. And now we consistently, thread when we have other projects, because we're thinking, oh, I know that group actually can have an interest in this. So that has been very, very beneficial for us.
And it does stretch. It's like fingers. I work with a lot of the public safety group and law enforcement, and they're talking about it on their side and how it's going to affect. Anybody like spaghetti? Just curious. Who likes spaghetti? Have you ever taken a piece of spaghetti and you start, sucking it in your mouth and you think it's like this little teeny piece, and all of a sudden it just keeps coming out and coming out and coming out, and all of a sudden it's this enormous piece and it slaps you in the face? So this is what this is like. It's like you get a little piece of something and all of a sudden it's like, okay, now this issue's out there. But it's the way that Gloria just explained it. It just keeps coming, and there's another piece, and there's another issue, and there's something else. And it's really managing all of these areas and knowing how to do it, knowing who to combine with, knowing what working groups, how to collaborate, doing all of these areas. And for the sake of time, we're not going to go over, we'll go skip through, I'll just show you the next 2 slides right here. Here's the next one. This is, again, all of the competencies that are demonstrated. It just goes on and on, because this group is just so complex with the projects that they're working on that they can't help but hit these by being successful. So why don't we go ahead and move to the next piece of this?
Okay, so is anybody overwhelmed already by the amount of moving parts that we're dealing with? Because we have some more. So as you can see, we're dealing with all of the moving parts within our organization, and I think this is a great example for us as staff of how our policy direction can evolve as we're looking at new members on the Board of Supervisors. So that's one thing that we're managing. But the other piece of it is we are one jurisdiction in a much larger region. We have 18 other cities, and we have a number of tribal governments as well. And each one of them is handling this issue independently. And so one of the things that our working group has decided to do, we're monitoring all of that, and we're providing we're reaching out to those jurisdictions as appropriate to let them know that we have this panel of experts and we have insight into some of these things for some of the jurisdictions that may not have those resources. So for example, the city of San Diego has medical dispensaries already in place. You could go into one today. They're looking at the recreational aspect of it. And so how would they handle cultivation? How would they handle if they wanted to manufacture marijuana products like oils and that kind of thing, concentrates. And so we've reached out to the city of San Diego to let them know what resources we currently have and what resources that we don't necessarily have authorization for at this point as they're crafting their ordinances, so they know what they're dealing with. We also have Lemon Grove and La Mesa, who in November, they passed an initiative to allow medical dispensaries in their jurisdictions. So we're reaching out to those communities as well, letting them know, if you're going to allow edibles, if that's going to be part of your regulation, DEH at this point doesn't regulate edibles. And so they have that information in their pocket to make informed decisions for their constituents and the people who live in their jurisdiction. And then we're also seeing issues with the medical marijuana, or the marijuana industry is looking at how they could push forward in other ways. So in Vista and Oceanside, there are currently ballot measures circulating petitions for signatures to try to expand whether it's medical or recreational facilities in those areas. So each one of these jurisdictions is approaching it differently, and each one of these jurisdictions could potentially be interacting with some of our departments in the group. So we're trying to get ahead of it and reach out to them and let them know, you can come to us, we can answer questions, but here's kind of where we're all at this point. And then so on top of that, we have the tribal governments they have land out in the unincorporated areas right next to some of our communities. Then they're starting to explore outdoor cultivation of marijuana on sovereign lands. And so how do we interact with all of that? How do we handle our constituents, our communities, as their neighbors are now going off and starting this new venture? And then so on top of all of that, we have the federal government. So the last administration, the last presidential administration, took an approach to marijuana because it is illegal on the federal level. They took a states' rights approach. So as long as your state had legalized at some level, whether it was medical or recreational cannabis, they were going to say, we're going to have our hands off. As long as you're following the law in that state, we're not going to get involved. But we have a new administration with completely different policy positions and priorities on a number of things. And so if that administration decides to reverse the stance on marijuana, that's going to have an impact not only on the local businesses here, the dispensaries, the medical dispensaries that are approved, that's going to have impacts to our tribal neighbors as well. And so we're trying to keep abreast of all of these different kind of facets that are coming at us. This is a really rapidly evolving policy issue. And then the last thing I want to add is the creativity of entrepreneurs. It is just amazing how creative people can be. And the new businesses that are cropping up because of being allowed to go into this area. Fortunately, we have Colorado to look at. They're a couple years ahead of us as far as where they're going with marijuana. And so we can see some of those businesses, like for example, they have restaurants with food that they've infused with marijuana. And so you could order a sushi roll and it has marijuana in it, and that's something that they're seeing in other states. And so we're looking at that as well and trying to prepare not only our elected officials and our staff and our departments within the organization, but also to serve as a resource for our neighbors as well, who might not have access to the all of the knowledge that this group can bring.
So Alex, it sounds like, and are you guys hearing this? I mean, it's amazing. It's like it's coming from all angles. You're like in a pressure pot. I actually watched the board meeting that you had, and it was coming from all angles. And you had the community, and you had the citizens, and you have a neighboring city that's actually already doing things, and you have all of these pressures from different areas. And so to move this along a little bit, can we go 2 clicks, Megan? There we go. So a lot of this that Alex is talking about are these 2 things. Huge in organizational acumen, huge. I mean, it's so sensitive. No matter where you're touching, there's sensitivity all the way around it. And then problem solving, all of it is problem solving. And so it's just being in this situation. How are you guys working with your communities, talking to the city that's doing all these things? You said even other ones. La Mesa, I didn't know that you're working even with other cities that are doing this. And I'll tell you one thing, I don't care how much I love sushi, I won't go to Colorado. Not doing it. So let's go to Megan.
Well, thank you.
Thank you, Alex. That was very good.
So to bring this full circle, I mean, I've heard some amazing things today, and I've been participating in the working group since the beginning, but it even feels a little overwhelming right now just sitting here, right? And we're really not done. We have a lot of work still to do. And in fact, the state of California, different agencies at the state level are right now developing regulations. So we don't really even know what it's going to look like when those laws are implemented because we don't have those regulations yet. So we're kind of waiting on that too. Those are supposed to be out in 2018. In addition, we don't really have board direction yet. We don't really know where we're going yet. And as you can see on this slide, there's a lot of things that have to be decided. Medical marijuana, adult use, are they going to allow deliveries? Are there going to be storefronts? What about cultivation? What about edibles? What about pesticide use? What about growing hemp? Which we haven't really talked too much about, but there's a big push on the agricultural side from many growers of, hey, we want to grow hemp. So there's a lot that's still unknown. And there's a lot that we're still going to have to be working on. And I'm looking forward to it.
Good. So that concludes the second panel. What did you guys think of that? That's big. That's heavy duty.